Hello and welcome everyone to today's webinar, A Policy for Transformed Lives, a framework for policy and systems change to support young adult mental health. We're really glad that you're able to join us for today's learning session. This is another opportunity to engage in content with us and discussion within the Young Adult Services and Supports Learning Community. As a reminder, this is a learning community supported by the Technical Assistance Network and is focused on helping all of us who are interested in creating innovative, efficient, and effective services for mental health care for youth and young adults of transition age. This is open to the public, and we particularly welcome our SAMHSA grantees who are engaging with us today. If you found us today on the webinar, we're hoping that you're also joining us at Ideas at the Institute within the learning community, where there are additional resources, thought work, and other learning opportunities for you to engage. I'm particularly excited to have you all with us today as we're joined by a wonderful new collaborator and presenter, Nia Westbay, and we have a really great presentation for you today. I'll be moderating and following along in the chat box, so we welcome you to put questions and comments in throughout today's webinar, including ideas and suggestions for future learning opportunities. I will introduce Nia here and then pass over to her to begin today's content. Nia is a senior policy analyst with CLASP Youth Team. Her work is focused on two-generation policies and strategies to support young, low-income parents of color, as well as girls and young women of color. She has expertise in youth development, qualitative and quantitative data interpretation and analysis, and the intersection of psychology, social policy, and program evaluation. We have been so impressed and excited to be sharing the work of CLASP work around policy needs for young adult mental health, and are so excited to bring these learnings to you. In addition to today's webinar, we've been uploading resources from CLASP within the learning platform. If you haven't taken a look at those yet, we encourage you to do that as follow-up to today's webinar. And as Tiara indicated at the beginning, we will be recording today's webinar as a learning opportunity to share with others. Nia, can I pass to you?
Sure. Thanks, Joanna, for that introduction, and hello to everybody that is joining us. I am as excited to be here as you guys are to host us, so thank you again so much for the invite and for the opportunity. We want to start off by making what might be a little bit of an unusual request for a webinar, but we wanted to try and make it as interactive as possible, given that it is a webinar. So I want to ask everybody who is with us to have your phone handy, or you can also do it in another window on your computer, but have your phone handy, and I'll say a little bit more about that in 1 minute. So first, I just want to talk a little bit about what we're hoping to do with you all today. First, we want to share CLASP framework for young adult mental health policy and systems change. We want to highlight a few examples of states and localities that offer strong examples of the components of this framework. And we want to engage everybody who's on the call with us today in some thought work focused on challenges and opportunities in your own system and some options for policy reform. So here comes the reason that I asked you to have your phone handy. So we're going to start off, it's going to be our practice run, because I know some of you already chatted into the chat box where you are joining us from. But what I would like you to do is either on your phone or in another window in your browser, if you could go to polev.com, and when you get there, it's going to ask you to enter Nia Westbay, my name, NIAWESTBEY 309. And that should pull up for you a map that just looks just like the one that's on our screen right here. And once you do that, if you just click on where you are calling from, we should start to see some locations pop up. So I'm going to give everybody a minute to do that. Go to polev.com. Oh, yes, it's working. Somebody already let us know where they are. Let's see if we can get a few more, because I know we have more than one person on the call. Go to pollev.com, enter NIA West Bay 309, and then click on where you're calling from. Oh, there's Rhode Island. Awesome, awesome. Oh, that looks like Maryland. Okay, Maryland is with us. Oh, and see, this is going to test my geography. Okay, that looks like we're getting down to North Carolina. Awesome. Any others coming through? Oh, there's one more. Looks like maybe Massachusetts coming in. Oh, and then we're getting out into the middle into Ohio. Great. Give it about 30 more seconds for folks to say where they're coming from. Oh, somebody off the map. So maybe somebody who is not from any of these places, which is super exciting. We'd love for you to tell us in the chat box where you're from. I did worry about if anybody from any territories was joining us because those are not on the map. Okay, great. So now we're going to go to our next poll. Which is about what you're hoping to get out of today's webinar. So this one it's easier to do from your phone. If you text NIA West Bay 309 to 22333, and then you'll be in for the whole rest of the polling that we're doing. And just type one sentence, one phrase, a short list of things that you're looking to get out of today's webinar. And as people start to send in responses, we will start to get a word cloud. So again, you're going to text to 22333, and then you're going to text NIA West Bay 309, and then it should welcome you to the poll, and you can text your response. Going to give everybody a little longer to get, oh, there we go. We're starting to come in. And as we build out our word cloud, the more people use the same word, the bigger the words will be. So several people are talking about ideas and work. Give it about another 30 seconds or so. Okay, learning is starting to grow. Work, ideas, learning. Awesome. All right. Well, I'm going to hope that we are going to be able to meet some of those goals for you all today. We will check back in at the end to see how we've done. Okay, we're still growing a little bit. We'll check back in at the end to see how we've done with this. And so keep your phones handy because we're going to use them a few more times throughout the course of the presentation. Okay. So first to tell you a little bit more about the Center for Law and Social Policy, or CLASP, which is where I am sitting in Washington, D.C. So CLASP is a nonprofit anti-poverty advocacy organization that we're celebrating 50 years this year. We really work on a range of issues that impact people living in poverty or living in low-income communities. We do our work in 6 main policy teams here at CLASP. We have an income and work support team that is focused on a lot of the public benefits that help low-income people. We have a job quality team that works on issues like fair scheduling, paid family leave, labor enforcement issues. We have a child care and early education team. We have a post-secondary education and workforce development team. We have a new team that's focused on immigration policy. And then we have the youth team, which is where I sit. Our team is a little bit unique in that we're the only team at the organization that is focused on a population as opposed to a particular policy area. So our work really intersects with and overlaps with a lot of the other teams that are at our organization. And, you know, our work in the mental health space in one way is somewhat new for the organization and for the team, but in another way isn't at all, because the team has always been focused on the experiences of marginalized young people of color, of opportunity youth, young people who are out of school and work. And what we were hearing over and over again from our partners is that mental health is a major issue for these young people. It is something that they consider important, that the people working with them think of as important. So we thought it was important for us to sort of step into that policy space. So CLASP, actually, our mental health work sits across two teams, the youth team, as I already mentioned, and then the child care and early education team. And we really engage in a number of different activities. We do some federal policy analysis and advocacy. We have a body of work that's focused on youth and young adult mental health, as well as a set of folks from our child care and early education team who are really focused on maternal mental health. And across both of those populations, we're engaging in technical assistance to states and to 4 states in a locality. And we are also supporting a learning community amongst those states, within those states, and across those states over the next year or so. So I'm going to talk with you all today about a framework that we have built out that we are really testing in that learning community as far as how to improve systems and policies to better serve youth and young adults. But I did want to do a little bit of background framing because on the youth team at CLASP, we think it's really important to center our work in the voices and the experiences of youth and young adults. And so before we started doing any technical assistance, before we started talking to anybody, any state agencies or anything like that, we really started our conversations with young people. So back in late 2016 and early 2017, we did a series of focus groups with African-American young people in an urban area, in a rural area, both in the Southeast United States. And we came out with the report that is linked here so that when you get the slides later, you can click on it and go to it if you want to. It was called Everybody Got Their Go-Throughs, Young Adults on the Front Lines of Mental Health. And we really worked from the comments, the insights, the reflections that young people had to do a couple of things. What you see on the left with the word cloud is really how young people understood mental health in that work. So a lot of what we think about sometimes as practitioners, as people at state agencies or at local agencies, is about sort of the clinical side or the diagnosis side. And young people really had kind of a different model and a different vision of mental health that was focused on positive attributes, behaviors, and values that they were trying to build towards. It was really sort of a strengths-based asset building kind of framework. And the other thing that we did was that sort of driven by the insights from our conversations with young people, we took a look at some data from the National Survey on Drug Use and Health. This data is a little bit older now, back in 2015, but to take a look at some differences by race and ethnicity within low-income young people and young people living in poverty to understand sort of what are some of the differences, what are some of the demographics, what are some of the issues, what are some of the challenges, and what really is the overlay of poverty on mental health. Now, we realized after we did that work was important and valuable, but that we hadn't talked to sort of the full range of young people living in this country. So in just last year, in 2018, we really decided to expand that effort and talk to young people from more backgrounds and in more places. And that resulted in a report that came out this past April called Behind the Asterisk that is focused on the perspectives of young people from small and hard-to-reach communities. So in this work, we had conversations with young people from the Asian American, Native Hawaiian, and Pacific Islander community, young people experiencing homelessness, young people in a predominantly white rural area, as well as Native young people who were living in an urban area, and brought all of those perspectives together in this report, which we may talk about in more detail at some point in the learning community. But for right now, just wanted to highlight that we really have a broad swath of young people whose perspectives are at the core of the policy work that we're doing and the piece that we're really going to talk about in more depth today. So this brings us to the big policy piece, which was also last year. We had conversations with stakeholders from around the country that we had heard were doing innovative work on behalf of youth and young adults and their mental health. Now, we know that this was by no means all of the good work happening in the country, but just sort of a sampling of places that we had heard from different stakeholders were doing interesting things. And so our guiding question for that work was, what are states and localities across the country doing from sort of a policy and systems perspective to support the mental health of youth and young adults? And we talked to over 125 key stakeholders, including advocates and staff in Medicaid, juvenile justice, child welfare, homelessness, youth development, youth workforce development, really all of the systems that touch the lives of youth and young adults in meaningful ways. And we talked to folks in 4 states and 3 localities. Those were New Mexico, Michigan, Oregon, Maryland, Los Angeles, New York City, and Louisville, Kentucky. And we'll come back to talk about some of what we found in those places in a little bit more detail in a minute. So in these conversations with folks, we pulled out this quote, which really gives us the title of the series, which was from a gentleman in Louisville, Kentucky, who was providing clinical services in the schools there, and really shared this perspective, which I'm going to read it to you all in full because I think it's a really powerful quote. Are we a service industry or a transformational industry? A service industry is kind of like McDonald's. How many burgers can we sell as efficiently as possible, provide a quality product so people keep coming back? You know, when you have a line at the cashier, how do you move them quickly and efficiently through? And you're really measuring your success by the number of burgers you sell, or whatever you want to sell. We do a lot of that out of necessity. We have to bill for services, so we capture time. We bill in increments of 15 minutes. We capture services, whether it's an individual service or a family-based service or a group therapy service. Or in Kentucky, we do bilateral services, which are with teachers and so forth. And we capture all of that and we measure it. All of that's great for service industries. But how would we have to change if we were in the business of transforming lives? Because that's what we really signed up for. And I think that this quote really resonated with us and resonated with a lot of folks that we've spoken to, because people typically don't get into mental health work because they want to count things or because they want to just count services, right? They get into it because they want to change people's lives. But a lot of how our systems and policies are set up force us into a space of having to count things and count time and count services instead of thinking about our actual impact and how we can be transformational. So with all of that in mind, we took a look at our interviews across all these different places and all these different people, looked to identify some common barriers across all these different places, as well as opportunities and innovative approaches. And we did really find some common challenges that we heard about across these different places. And again, these are all places that were doing some things well, but even everywhere, even places that are doing things well have some challenges. So the big challenges that we heard about were the medical necessity definitions, or in some cases, interpretations of those definitions, and we'll talk about that a little bit more. Reimbursement and workforce issues, either low reimbursement rates and or not enough people to do the work, and the way that those two things are related to each other. That even though almost everybody agreed that prevention was important and getting upstream of problems was much better for people than waiting until something was really wrong or in a really bad place, there was very few examples of places that were really good at investing in prevention in this space. There was a real issue with the justice system serving as the entry point for services. So a lot of the juvenile justice stakeholders and others that we spoke to would talk about how young people would end up in the justice system, particularly young people of color, and would finally get the services that they needed. But if somebody or something was in place to intervene earlier and differently, then they wouldn't have ended up in that system. We heard quite a bit about challenges with cross-sector collaboration. All of the places that we spoke to had some combination of folks who were talking together and working together to try and do good things for young people. But there were challenges with that too, and whether or not the whole range of partners to be effective was at the table was an issue. And then meeting the needs of diverse populations. And that really can look different in different places. It might be different racial groups, different ethnic groups, different language groups. But we also heard quite a bit about the sort of an urban-rural divide and the challenges that are different with meeting the needs of young people in an urban setting versus a rural setting and what that looks like. So now we're going to go back to another poll so everybody get their phones back out. And this one is going to give us a chance to talk a little bit about what are some of the policy and system challenges to meeting the needs of the youth and young adults with low incomes in your system. So I kind of gave the list of the things that I just talked about that we heard in our conversations with folks. But now we want to hear from you. Is it one of those things? Is it something else? So go ahead. You shouldn't have to text. Again, you should still be in the poll unless you said that you wanted to leave. And you could just text one of these letters and hit send, and then we'll start to get a sense from the folks who are on the call about which of these challenges are sort of most pressing in their system. Got a couple of responses starting to come in. Right now we're heavily in the reimbursement and workforce space. Okay, so now I'm seeing some lack of investment in prevention, challenges around cross-sector collaboration, more reimbursement in workforce. You have about 30 more seconds for folks to send in responses. All right, thank you all, and thanks for playing along with my polls. I feel like it makes it a little bit more interactive than webinars normally are. We'll do a couple. Oh, we had one more that came in as something else. If whoever said something else, we'd love it if you could chat in the chat box what that something else is. So we're going to circle back to some of these challenges as we kind of talk through work in different places and ideas that people have to take away. So based on all this work, all these conversations, we really laid out a framework of sort of what it takes to effectively meet the needs of youth and young adults. What are the things that we heard in these places are working, are helpful, and then what is some of what could help us to move there, right? So I'm going to walk you all through this a little bit. And we just, again, keeping in mind the quote from Ron about moving from sort of a service model to a transformational model where we really shape our systems and policies to support transforming lives as opposed to just providing services. So in terms of the way things are now, what we were essentially hearing from folks is that clinical treatment, it has pretty good coverage in Medicaid. There's low reimbursement rates. There are issues with workforce that are a challenge. The services may not always be culturally appropriate, but at least there are services and they are billable. And there's a good number of services that are billable depending on the place. But the other pieces that we were hearing from folks that were also important to supporting the mental health needs of youth and young adults, thinking about physical and behavioral health integration, addressing the social determinants of health, applying more of a prevention lens, and going back to our word cloud from the beginning, thinking about wellness promotion from the perspective of strength, assets, and safety. There were many fewer examples of places where you could use Medicaid, the main insurance that supports low-income youth and young adults paying for these things. It just, and a lot of times people perceive the barrier as the definition of medical necessity. So we wanted to think with folks about what are policy changes that people can make in their states or localities, because a lot of these decisions are made at the state or local level, that would help to move some of those pieces that are on the outside of the puzzle inside the puzzle to get us to a more effective and more transformational system for youth and young adults. And we really thought that it's very important that these policy changes be supported by some key approaches that we also alluded to in the challenges. Those are effective child-adult system partnerships, authentic youth engagement, effective cross-sector partnerships, interracial equity, and cultural relevance. So we're going to come back to those in some detail and go through some of the different examples that we learned about of some of these different pieces. Because there are innovative examples from around the country of states and localities who are working on these different pieces. So if we start with sort of the puzzle pieces that were furthest outside of the puzzle, that had the most work to do to get to the inside, we really want to think about policy change that expands the boundaries of healthcare to include these things. So if we start with integrated physical and behavioral health, that gives us an opportunity to highlight some of our learnings from New York City. I don't remember seeing anybody from New York City or New York State on the line, but we talked to a lot of folks there. Now, New York City is a pretty unique place. There are more people in that city than there are in some states, more than 8.5 million people. They have they have the largest public healthcare system in the country, and there really has been some effort in both the city and the state over the last few years to make some major improvements and some reforms to their Medicaid policy. And just on the left-hand side, and this will be true of all the places that we talk about, we just have a few quick demographics around poverty and poverty for young adults in these places. So you'll notice that in New York City, the poverty rate for young adults is higher than the poverty rate for the population overall, and that there are large numbers of young people of color in New York City who are living in poverty. So we learned about a couple of exciting things that New York City has going on to address behavioral and physical health integration. So one is their Spring into Health effort, which is a joint project between the Department of Youth and Community Development and the Department of Health and Hospitals, which is really working collaboratively to try and make sure that young people have a sort of seamless health experience between their mental health and their physical health. And then we are privileged as well to have on the advisory board for our work a woman by the name of Angela Diaz, who is with the Mount Sinai Hospital Adolescent Health Clinic, which is a model of integrated physical and mental health that uses co-location of services. So they have doctors of physical medicine, doctors of mental health, co-located in the same location, but sort of more broadly infusing their center with trauma-informed approaches, with wellness promotion, with youth-friendly practice, with really thinking very intentionally about how to serve young people who are undocumented, who are LGBTQ, who are sort of having a lot of different kinds of experience, and finding ways to use Medicaid to pay for it. That was one really exciting example that we learned about in terms of integrating physical and behavioral health that really was making a difference for young people. So next I want to go to an example that we want to highlight in terms of supporting the social determinants of health, and that's going to take us out to the West Coast and Oregon. So Oregon is also an interesting place. It's sort of a national leader in progressive healthcare policy that really long before the Affordable Care Act and all that kind of stuff was already taking a lot of steps in terms of healthcare reform and trying to ensure uninsured people in the state and that sort of thing. But with the passage of the ACA, the Affordable Care Act, and Medicaid expansion, it really transformed healthcare delivery in the state and pushed Oregon or supported Oregon in reorganizing their health system into coordinated care organizations, which I'll talk about a bit more in a minute. And other important things to note about the context in Oregon, so this is a state with a lot of rural and frontier counties, in addition to some urban areas, where again, and this is a trend you're going to see, the poverty rate for young adults higher than the overall poverty rate in the state, and where you have much higher representation of white young people in Oregon, and lower numbers of young people of color, although there are significant Native populations in the state of Oregon. So to talk a bit more about Oregon's coordinated care organization. So this was a restructuring of the way that Medicaid is delivered in the state, where it really brought together mental health, physical health, and all sorts of supportive services under the management of these coordinated care organizations that work around different parts of the state. And this has allowed them to do a lot of things that support youth and young adults, including having peer-operated centers that are associated with the different coordinated care organizations. But what we really wanted to highlight here was the ways that they found through these coordinated care organizations to reimburse for addressing the social determinants of health using Medicaid dollars. So they got a waiver that allows for the CCO to bill for health-related services. So that could be food, that could be housing, that could be employment support. And not only at the individual level, but they're really starting to think about community-level health and how, so they're thinking about things like what green space looks like in a community and just communities that have a lot of people who are who access the services from that particular coordinated care organization. But if you think about something like a park or like green space in a community, that actually benefits the whole community as opposed to just the individuals who have the benefit. And when we were having these conversations with folks in Oregon, they were really in the process of redoing or renewing the contracts of all the CCOs and really going through a very intentional process of talking with folks and figuring out how they can improve upon this even more moving forward. But it was really exciting and really innovative to hear from Oregon about how they've found ways to not just ask about the social determinants of health, not just to nominally recognize that these are important for people's outcomes, but to really think about how they could bill for them, how they could do something about them using Medicaid dollars. Then we're going to talk about prevention a little bit, both at the individual and community level. And this is giving me a chance to highlight New Mexico. Same trend, young adults in New Mexico have a higher poverty rate than the state overall, although one of the key parts of the context there that folks from there said over and over again was we are a poor state. There's a very high poverty rate in New Mexico. Like Oregon, a lot of rural and frontier counties. And there were some challenges there several years ago with their Medicaid program that they were really still recovering from, and they had done some real damage to the behavioral health infrastructure in the state. But with that said, we learned about some innovative prevention efforts that were going on there. One piece was centered in their school system. There's an intervention called the Good Behavior Game, which is really focused on social emotional learning and is a primary prevention strategy that's used in schools to try and help build young people's social and emotional competencies so that they are better able to deal with different challenges that they might face along the way. And they also sort of had a newly minted suicide prevention program that was doing some exciting work around the state to try and address and prevent suicide. And then finally, we're going to go to wellness promotion focused on strength, assets, and safety. And again, I just want to give you a reminder that this piece is really important because it is so closely aligned with what young people say is their vision for mental health. What they want is to see themselves grow, develop, change to become mature, independent, successful, motivated, focused people. And so the interesting thing here was that we didn't find really any examples of folks who were able to bill Medicaid for these kinds of support. The people that were strong in supporting sort of strength, assets, and safety tended to be people more in youth development and youth workforce development space, so folks who are running after-school programs, or the example that I'm about to talk about in Los Angeles. So again, another very high poverty area, and also a unique place because California has a millionaire's tax that they've been able to dedicate to doing a lot of innovative things around mental health and supporting a lot of community-based programs. And so it's a little bit, again, of a different place, but I guess at the end of the day, everywhere is a little bit different, right? And so they had a program that was based in their mayor's office called GRID, or the Gang Reduction and Youth Development Program. And it targeted young people who had been gang involved or who were at risk for gang involvement, but they were really focused on helping those young people to build their leadership skills and a sense of community pride. So they had responsibility every year to fundraise, manage, and plan an annual youth focus. And that effort was completely directed and run by young people, and was also focused on ensuring young people's safety and connecting them to positive activities, which was a central part of GRID's work. So now we're going to do a little bit of a reflection about effective support. So I'm going to get our next poll ready. I am going to get your phone, ask everybody to get their phones out again. And I just got a note that maybe folks who were trying to do this in their web browser were not having success. So hopefully I have now fixed that, and you can respond either using your web browser or your phone. And the question is, which of these priorities that we just talked about for meeting the needs of young adults have the strongest policy support in your system? Improving clinical services, integrated physical and behavioral health, addressing the social determinants of health, prevention, or wellness promotion. You can go either use, again, text your response, A, B, C, D, or E, using your phone, or now you should also be able to, through your web browser, if you go to the poll, this should pop up. You should be able to provide your response. Give folks a couple minutes. We're starting to get a few responses in. And we'll give folks maybe another 30 seconds or so to respond. All right, well, with what we have in so far, it's pretty clear, and this is not surprising to me at all, given that this is where most of the dollars are. There is a lot of support, I think, in systems, generally speaking, for improving clinical services, right? And that's absolutely important. We want to make sure that what we're offering to young people is quality, meets their needs, is aligned with their needs, because the risk, and one of the things that we heard about in our conversations with young people, is that when they have a bad experience in a clinical setting, it can put them off for life. We talked to a lot of young people who were not so high on a lot of traditional clinical services, quite frankly, because they had a bad experience with them. I'm glad to see, though, that we have at least one person whose system is really starting to think about prevention, because this right here is the challenge, right? We have sort of all our eggs in one basket, on that one puzzle piece, on that clinical services piece, when in reality, all of these other things are also critical to meeting the needs of youth and young adults. Okay, so now we want to talk about some of those pieces that we said were so important for supporting the policy changes that we're talking about. So the first is authentically engaging young people as partners. And this is something I know that there are a lot of great resources about it within the learning community. It's been sort of a topic in this space, something a lot of folks are thinking about in the context of their systems of care or their healthy transitions grants. But we talk a lot here at CLASP about sort of youth engagement as a ladder. And, you know, there are a whole bunch of steps along the rungs of that ladder, ranging from sort of just nominal involvement of young people, but where adults are still really controlling all of the decision making, to consulting with young people where you're sort of asking for their input, to true partnership, where young people are sharing decision-making authority on equal footing with other folks in their system. And so we really were interested and excited to hear about places that were sort of more in that space, that were truly in partnership with young people as they were thinking about their systems and how they could improve their systems. So I'm going to talk a little bit for a minute about the state of Maryland. This is one place where the overall poverty rate is actually higher than that of young adults, but there are definitely absolutely pockets in Maryland of high poverty rates for youth and young adults. And Maryland is interesting because they've had some challenges in their behavioral health system in the last few years that has sort of put them in a rebuilding space. But through that, they've really kept a focus on peer support and sort of building out peer support across the state, interestingly, particularly in a lot of the more rural areas. So we wanted to highlight On Our Own Maryland, which is an example of an organization that is doing peer-operated wellness and recovery centers across the state that has a component that's focused on transition-age youth. And the really important thing with peer-operated wellness and recovery centers is that they are run by people with lived experience, for people with lived experience, with people with lived experience. It's really about sort of empowering those people to manage the space, to control the space, to figure out what programming happens in the space, and to sort of, through that process, to be managing their own wellness and their own wellness process. So next we're going to do a 2-4. We're going to talk about some efforts to effectively partner across sectors and to apply a racial equity and culturally responsive lens. And that's going to take us over to Louisville, Kentucky, which is a smaller city in Kentucky. It has a history of commitment to health equity, some strong leadership, and some very strong collaborations across youth-serving systems. Louisville is home to the nation's oldest municipal-level health equity agency, which I never knew before we talked to them. Medicaid expansion there, like other places, has significantly increased coverage and reduced emergency room use, but there is this sort of outstanding issue in Kentucky where they imposed some work requirements on their Medicaid program, and immediately tens of thousands of people lost their coverage. And there was a lot of concern from the folks that we were talking to about what that would mean for young people in their state. Just to, again, emphasize that these policy decisions really do have real-life implications for people. It really do make a difference and set the context for how everything else can happen. So one of the really powerful things that we learned about in Louisville, and this was in the report that their health equity agency produced, was they used this analogy of a tree. It's really a social determinants of health framework, but they managed to take the language and turn it into something that was really user-friendly, right? So if you think about a tree, the leaves are the health outcomes, right? That's what you see. That's the part that's visible. The root causes are essentially social determinants of health. That's housing, that's economic development, that's the condition of the neighborhood, that's all the different sort of underlying pieces that shape what you get in the leaves, right? Because if you don't have strong roots, then that's going to impact what your leaves look like. But what was the added piece that Louisville put into the conversation that was pretty unique was to think about the soil. And they described the soil where the roots are growing as systems of power. And systems of power are sort of a lot of the isms, things like racism or sexism, that then shape and feed and nurture the roots that in turn give you the leaves on the tree. So they really had added this layer of thinking about systems of power and how that affects people's experience in a meaningful way that really brought a lot of their stakeholders together and helped them to have a shared understanding of the way some of these things are operating for folks, and helping people to think really clearly and think really intentionally about where they're intervening. Are they thinking about the soil? Are they thinking about the roots? Are they just looking at the leaves? The other thing that I wanted to say about Louisville really quickly is that they it's a small city. It seems sort of like everybody knew everybody, but the strength of the partnership that they developed by using sort of these common frameworks and this common language was really making a tangible difference for young people, where when we talked to the person in the juvenile justice system who knew the education person, who knew the clinician, who knew the university clinic, who knew the workforce person, they were sort of all, it was one of the few places where there really was great participation and great collaboration of a bunch across a range of sectors. And then finally, want to talk about effective partnership across adult and child serving systems. And I have no example to share with you, because what we found in our conversations was that nobody was really good at this. This is so important. You know, I'm sure everybody, I'm preaching to the choir here, everybody that is on this call understands that we have so many issues when young people make that transition from child systems to adult systems, and that there are so many issues with coordination and collaboration and getting young people across that gap and being developmentally appropriate, that it's really the fact that there weren't really good examples that we found of folks who are really managing the links across that system well, really speaks to one of the core challenges at a systems change level that we all need to be thinking about to serve youth and young adults more effectively. So with that in mind, I wanted to hear a few ideas from you all, and I can also share, if we have time at the end, a few things that we've heard in our learning community that is now underway, but was less so when I was developing these slides. So I have two things that I would like us to reflect on. Everybody get the phones or get that browser back out. So the first question is, I would love for you to text or enter into your browser an example of supporting wellness promotion, strengths, assets, or safety for young adults that you can think of in your system. You're just going to type your response, and then the responses will start to appear. Any examples that you can think of in your system. Because I wanted, just because we didn't hear about these things in our conversations with folks doesn't mean they're not out there. And since these were areas that we hadn't heard a lot about from folks, we'd love to know that what you all are doing where you are. We're starting with an example of supporting wellness promotion, thinking about strengths, assets, or safety for young adults in your system. Ooh, it's quiet so far. I hope somebody has some examples. There we go. Okay, so we have youth voice is centered. What else? I think with this one, I left room for people to send more than one response, I think. So even if you've already responded and you think of something else, I think you can add another answer. I'm going to give it like another 30 seconds. If not, we might really have to hold this as a space that we as a field really need to do work. All right, let's take a look at the next one, which is hearing about what are some of the high priorities in your system in terms of system change strategies. So again, it's the list of the ones that we just talked about: cross-sector collaboration, authentic youth engagement, adult-child system partnership, or racial equity and culturally relevant lens, or maybe none of those are high priorities in your system. And so I gave an option for you to say that too. We'd love for folks to text their responses. I already see one starting to come in. Thanks for being on the ball, guys. And let me actually fix this one so that people can do it from the website as well. There we go. Now you can respond. either in another browser window or by texting the letter A, B, C, D, or E to share your response. Got a couple coming in, giving it about another 30 seconds for folks to share their responses. What strategies are high priority in your system? All right. Thank you all. So the youth worker in me, my heart sings whenever I see that authentic youth engagement is a priority. And, you know, we can talk about this a bit more in the question and answer period if people are interested. But there's definitely a lot of really great resources within the learning community around authentic youth engagement. Also glad to see the focus on adult-child system partnership, because that is really a critical issue. It's something that we're working on with both of the places that are part of our learning communities. That's something where we're really putting some intentional time and effort to try and make that piece better, because without that, that's how we keep losing young people across that gap. And sometimes, just to give examples from some of the places that we're working with, there's misalignment of definitions or eligibility criteria across that gap that results in young people getting lost in the shuffle. And so that's one of the things that we're thinking about. Sometimes it's about unclear responsibility. Who is it? The child system's job? Is it the adult job? Or do you really need a transition age youth-focused infrastructure, an office, an agency, a directorate of some sort that really has responsibility specifically for this population to help them move across that gap? Now let's slide back. And we're going to go to a question slide. We've talked about a lot of things. We've had a few polls, but really wanted to give you all a chance to ask questions, share ideas, share reflections. So I'm going to give it to Joanna to sort of manage the receiving of questions process, whether we want to unmute people's lines or have them chat them to us. Not sure what are the instructions, and we'd be happy to answer any questions before we do one last poll to close this out.
For sure, Nia. Thank you so much for everything you've offered us today. Definitely continue to use the chat box if you have questions. And we have a few minutes to respond to them. So feel free to type. Tiara,
Joanna, I'm not sure if you're still muted. Should folks chat questions, or should they sort of raise their hand? What are the instructions for people if they have questions?
So folks can use the chat function to go ahead and put in any questions or comments about the presentation.
And Tiara, just checking, can you hear me now? This is Johanna.
Yep, we can hear you.
I'm not sure what happened. I'm going to take a look in the chat box and see if there are any questions in here so far. I see just a few comments, but no questions. If anybody wants to ask any questions, feel free to chat them to the group. Or if nobody has any questions, we can jump to the final poll.
All right, Nia, you must have done a really good job. I think we could go to the poll.
All right, here we go. Let's go to the last poll, which is really to take us back to the beginning. Folks had some things that they were hoping to get out of our conversation today. So I would love to close us out by seeing where we ended up. So last time, you can either text your response or you can type it in that other browser window, what is one transformational policy or system change idea that inspired you today? Go ahead and send your responses. Are folks still with us? Ah, there we go. All right, we got one response. We love that tree metaphor at CLASP. We've been using it for many things ourselves. That's some things coming in about partnership, adult child. There we go. Now they're starting to come. Give about 30 more seconds. Nice. It looks like since none of the words are particularly larger than others, we have lots of people who took lots of different ideas from today. Oh, but now we got, peer-operated recovery centers have definitely popped out. Great. All right, everyone. A few more things coming through. All right. Well, I want to thank you all so much for being with us today and for joining us for this webinar and giving us the opportunity to share these ideas with you all. Again, linked is each of the pieces of the Policy for Transformed Live series, mostly so that when we send out the slides afterwards, you can click on the links and read the whole report if you're interested in that. And I am happy to respond to any follow-up questions or talk with people further. You can reach me at the email address at the bottom of the slide. And I think that that is it, other than a few closing slides that is just references and a last look from SAMHSA for their support for this effort. Thank you all so much, and I hope everyone has a great afternoon.
Awesome, Nia. Thank you so much for being with us today. Thank you, everyone, for listening. As you leave today's webinar, there will be a survey to fill out. Please let us know what you're thinking. It helps us improve future webinars, and we're really looking forward to seeing an interaction with each of you within the Young Adult Supports and Services Learning community, and we'll share information as a reminder about that in our follow-up. So thanks, everyone.